Linda Douglas is the Trauma-Informed Services Specialist at the Coalition, and Linda spends a lot of her time talking about the intersection of issues that have a foundation in trauma. So Linda, we'd love it if you'd spend a few minutes talking about the impact of this pandemic and the intersection of mental health, trauma, and substance misuse. And could you share with us a little bit about what you're seeing in terms of trends of working across networks and the potential long-term impact of these life-changing events?
Thank you so much for having me this morning. I think one of the things that I want to get across is that people who have experienced trauma are having to manage their feelings and the effects of that trauma in ways that they've never had before. They don't have the same supports that they had before. Many of their counselors have moved to using technology to meet with people, and that can be a little daunting for some people. And not everyone has access to the technology that they need in order to be able to access those supports. With libraries being closed and with restaurants that have Wi-Fi and things like that being closed, and just access to the types of things that you need in order to be able to talk to your supports. Many support groups for persons who are experiencing substance use disorder, those have moved to online formats, and that also has been daunting for some people because those meetings have traditionally been in faith community, in other areas throughout the state that are closed, and so they've had to move to a format where they're not in-person meetings, and that can be very difficult. So the biggest difficulty for people who've experienced trauma is not knowing when this is going to end. And that increases a sense of powerlessness over the situation. And that sense of powerlessness can be very reminiscent of the dangerous situation that they may have been in as a child or as an adult in an intimate partner relationship, that they don't feel like they have any control over this. And we know, and as many of the panelists have talked about this morning, that social isolation, it does not create domestic violence or sexual assault. What it does is it increases the opportunity for it. And we need to recognize that there are a lot of people who are not able to reach out for anything. So when it's just very difficult. But there's good news. The fact that we've been able to ramp up and be able to provide technological services, that there are organizations that are making phone calls to people that are on their lists that they've had contact with before, just to check in and say hi. I received a phone call yesterday from a local organization that I had reached out to once last year, and they just called to check up on me to make sure that I was doing okay and if there was anything I needed. So these things are happening. Organizations are coming together and they're saying, let's make sure we don't forget people of color. Let's make sure we don't forget people in this community. Let's make sure that we're meeting the needs of everybody equitably. And that type of organizational collaboration is so important all of the time. But the fact that we have been able to do this through this crisis is even more astounding, that people are just trying to do their best and work with each other and know that the primary objective is to help those people that we normally serve. And if we can help a few other people along the way also, we're going to do it. So we're not going to limit the services that we provide. I think I just want to also remind that, so many of the folks who have mental health and substance use disorder issues and trauma are home alone with their children. And their children are also experiencing some of the effects of the being unable to put their finger on, what is really happening? What is this sickness? What is going on out there? And so parents are struggling with that. But there are lots of places that are working with parents in order to be able to support that. So I just want to thank everybody for listening to all of this morning, and I'm going to let it move on.
Thank you so much, Linda.